morning, everyone.
Good morning.
Good, that's better, right? I know there was delay because I don't take Route 18 south. Judy told me that there's an accident and so there is a backup. So I'm hoping some people will join us shortly because we did have a lot of registration. But nevertheless, we don't want those people who are already here to wait any longer. So we wanted to start the program. So before I introduce our next speaker, I just wanted to ask you a quick hands to show. How many of you know what is a talent network? I have to do my marketing. Okay, 2 of you, right? Okay, including me. Talent network is actually as an initiative that is helping workforce development in terms connecting anybody and everybody, right? How many of you here don't want a job? I didn't think so. Whether we like it or we don't like it, we have to work, right? Especially in this economy, I think I have to work another 25 years. I'm young, by the way. So we are thinking, we connect job seekers who are looking for a job, who want to transition, and who are in high school, who do not know what they need to study and which field they need to go, and education providers. Okay, is it okay if we currently teach what we teach or the industry requirements have changed? And so we talk to employers and find out what kind of a talent that they need, and we tell the training providers and training to help them to modify their curriculum. In essence, we connect education providers, employers, people who are looking for jobs, people who want to transition into different jobs, and people who want to upskill, they want a better job. So in essence, we work for almost everybody who lives on earth in New Jersey. Pretty much that's what we do, and we try to target almost everybody. I know Nish for a very long time, right? And every time I talk to him, I can see his passion in developing the tools and the apps. I had seen, his game console, and I had always admired that. And I had been talking to him for a very, very long time. And when we said, we have a new assessment tool, I want pediatricians and parents to come forward to listen to it. Can you organize an event? Part of my job is to do event planning, to educate people about different things that are there in healthcare, whether it is a patient care, whether it is for parents, how they can use it, or even to talk to employers, what kind of a program you need to do in order to reduce absenteeism. So we do pretty much everything. So when he talked to me, I said, why not? Rutgers will be happy to host that event. And we will be very happy to talk to everybody about how you can do an assessment, how doctors can do an assessment to find out about autism. Just to give you a little story, one of my friends, his son, he had 3 kids, he has. The younger one was not talking for about 2 years now. So they didn't know what was the problem, why is he not talking? Then his pediatrician told him, what language do you speak at home? Okay, that is a problem that we, immigrant population, we face. Then if you tell them, okay, we speak a lot in our mother tongue, oh my God, your kid is confused. Outside the world, he listens to English and you are talking to him at home in your mother tongue, so there are 2 different languages are thrown at him, so the kid is confused. So try speaking in English at home. Then he should be fine. Then they go, okay, now we are talking in English at home all the time, and now 1 year passed. They go to WebMD. Now everybody can be a doctor, right? You just Google and you find something, you are a doctor. So they go to WebMD, and WebMD they got some information. Feed your kid with a gluten-free diet. Okay, so he can speak well, gluten-free diet. So then the family goes on with a gluten-free diet for 6 more months. Now the kid is like 3.5 years old and he cannot still speak. So that is when I I met them and I said, why don't you go talk to a pediatrician first, who is specialized in understanding early childhood development. Don't just go to your regular pediatrician. Go to somebody who is a specialist, and I referred him to Dr. Nimisha Shukla, who has her daughters. They work a lot on autism, and they raise money for the awareness. They do a lot of school. Then they went for that. They went to the county for a yearly assessment, screening, and oftentimes parents get this feeling, oh, my kid doesn't have autism. No, you are wrong. It is just some developmental issues. We are not spending time with our kid. We may have to spend a little bit more and talk to him more, than he will be fine. He or she doesn't have autism. There is no developmental issues. Then they said, okay, let me get an appointment with Dr. Seshadri. Let me go for neurological examination. And after all of that happened, now the kid is like about 4 years old. Now they started putting him in therapy, and he is able to respond, and he is able to, talk back, and there are some improvements. He is able to express that. So I'm not just singling out that parent, but how many of other parents that we know who might want to do that, right? So that is why the early development and early screening is really, really important. And that is when I started talking with Nish, I said, it's a great opportunity, and this is where we need to focus. And there are a lot of children who are getting affected. Before I introduce my speaker, I just wanted to tell you one thing, is that if any of you, if you are an employer, if any of you want to hire somebody who has a disability, then there are incentives through Department of Labor. So you can talk to me about those incentives. Yeah, I want to hire somebody who had autism. I want to hire somebody who has some other disability. How can you help me? So we can help you. So you can take my contact information and you can call me. Okay, and that is my little bit of my own marketing about the talent network. So coming to the panel discussion about today, I'm going to introduce, probably many of you know, Kara Reagon from Autism Speaks. I heard a lot about Autism Speaks, and this morning when I was introduced to her by Nish, I said, I have been trying to reach you guys for a very long time. I need to talk to you about it. And so without much delay, I'm just going to introduce her, and she's going to come and talk to you about benefits of early ASD screening. Thank you. Kara?
Good morning. Thanks for having me and Autism Speaks here this morning to talk to you. Okay. So I want to talk to you about early screening for autism. You've probably seen it's been in the media and in the news recently. But I really want to talk to you about how it benefits all children, parents, pediatricians, providers, schools, and even beyond. The impact of early identification and screening has benefits across a lifetime. So recently, the United States Preventative Services Task Force put out a draft recommendation against universal screening for autism. And we were really disappointed in that, and we provided an official statement when it was open for comments and feedback. They are not endorsing universal screening across all children at 18 and 24 months. And what we know about early screening is that associations and other professional organizations really are urging people to do universal screening at 18 and 24 months. And a lot of research right now actually is indicating that there are symptoms earlier than 18 months, and that autism can actually be identified in high-risk babies in infancy. But the American Academy of Pediatrics, the American Academy of Child Neurology, the American Academy of Child and Adolescent Psychology, the Speech Association, the NRC, Autism Speaks, the Baby Sibling Research Consortium, their research supports early identification of autism and universal screening. In addition, the WHO, the World Health Organization, and Autism Speaks identify that in the context of early childhood programs, if we can embed early screening into already existing context of early childhood development, then the benefits would be huge. So there are a variety of assessments currently available, and with little guidance or use, one's available on our website right now known as the MChat, which, how many of you are familiar with the MChat? Okay, it takes less than 5 minutes to do, and it's open source and it's freely available. So what we know about early childhood development is that the environment has a huge impact on childhood development. And so it's not just genetics, environment plays a piece as well, and across a lifetime. So one of the groundbreaking studies by Hart and Risley in 1995 showed a disparity across language development as early as 18 months for these kids. So looking here, you can see that the difference that I think they say is like 30 million word gap by the time that these children are age 3. So children who come from highly talkative families, highly educated families, by the time they're 3 years old, their vocabulary is over 1,000 words. Children in working class families, middle class families, probably around 749. And children in low socioeconomic status and poverty, 525 words. That's a huge gap that can be overcome. It's basically what Hart and Risley found was it's not just the socioeconomic status, but it's the dance of these interactions that people have early in life. So the families who talked a lot, they talked not just business, what they referred to as directions or instructions. Get your shoes, stop, come here, don't do that, no. They danced with their child. They had these interactions, they provided elaborations, they pointed out things in the environment. They heard more affirmations versus less redirection or negative comments about prohibitions in their environment. So they still did business, they still had feedback about their environment, but the amount and quality of interactions about what they were saying to their children was vastly different. So that the amount of words, they were less, not necessarily bossy with their children, but they were providing more opportunities to learn new vocabulary. So if you go on our website, in the upper right-hand corner, you see next to toolkits, it says screen your child. And that will bring you to the MChat R. It takes about 5 minutes, and if you have parents that are concerned or they're in your office or what have you, can direct them to this. And as a result, they'll get a probability about what to do next, who they should go see, a developmental psychologist, a pediatrician, neurologist, what have you, someone in the area. The other thing that we have, I think some of the hesitancy early on for pediatricians to give a screening or refer for a more complex, comprehensive evaluation was, what supports do you then give the family? So with Autism Speaks being 10 years now, we have a 100-day toolkit for families that you can direct them to our website. They can download this for free. And it basically walks them through the next 100 days about going through the process of getting a diagnosis of what to do next. And I think that's often very, very difficult for families. The next thing is, if you go to our website as well, is the resource guide. And on this resource guide, they can click what state they're in here in New Jersey, and they can click and see what providers are available, what service providers are in their area. The other thing that we know is that early intensive behavioral intervention, it has a huge outcome on the trajectory of these children's lives. And so if you're looking for a behavior analyst, you can go to the BCBA-D website, and they actually have a button that says find a behavior analyst, and you can type in your zip code, where you live, and it'll come up with all the people that you can then get in touch with who are certified. So one of the efforts that Autism Speaks has this year, or has been working on in the past couple of years, has been a partnership with the WHO. And what we're looking at doing is developing a parent skills training. And this is not necessarily just for autism, it's for any child who are showing some delays in development. And basically what we know is that the environment in the home, especially in low resource settings, and where there access to care, and might be barriers because of transportation, distance, language, education. There might be stigma associated with getting a diagnosis or having a developmental delay. There might be shame or embarrassment with the families. Or they might not know to actually address these issues, that these are even concerns, because life in this day and age is hard. There's a lot of competing stimuli in our environment. The internet, we're working, workloads, keeping your house, how to pay your bills, how to get food on the table, how to find time to sleep or shower, or whatever it may be. It's difficult for families. And if we can help families understand that we should be looking for these developmental milestones, that would be huge. And not just looking for them, but how do you actually teach these skills to young children early on in development? And so we're working with the WHO, and we just had our first regional training in China last week, and developing a parent skills training early on to help families promote interactions in the home, how to help children interact with their environment, how to play, because we know that play is an important piece of development in language, and how to regulate throughout their day, because kids on the spectrum, as you know, in pediatricians, behavioral pediatricians look at, is that oftentimes kids come in and parents are worried about, do they weigh enough? Are they feeding? Are they sleeping? Are they feeding? Are they growing at the rate that we want to? Kids with autism early on, they'll have problem behavior, they'll have tantrums or meltdowns, but they're exaggerated, they're not the same, they don't respond to the same parenting feedback that typical children might respond to. And so the longer that those behaviors are practiced, the harder they are then to change down the road. And so oftentimes, if parents hear they'll grow out of it, if we take a wait and see approach, it's really, you're playing a game of roulette, because there's the possibility that they won't grow out of it. And in fact, if we don't intervene, because we know this is a pervasive developmental disorder, if we do not intervene, that those behaviors will stay the same or get worse over time. And so we want to intervene early on. We know that autism across a lifetime, here in the US, yearly we spend $236 billion treating individuals with autism. That's the cost per year. If we can intervene early enough and give these kids a chance at having a productive life in terms of working as an adult, participating in their community, paying taxes, and that's all from early screening. Okay? Early screening does not necessarily mean later diagnosis. If early screening identifies kids that need help, and we get them the help that they need, perhaps maybe then they won't later down the road be classified as developmentally delayed or as having autism spectrum disorder. Residential care for individuals on the spectrum costs between $150,000 and $175,000 per year. And that's probably a low estimate today. Inpatient for adults, adolescents who display severe, life-threatening, challenging behaviors is estimated to cost $6,000 per day in a hospital setting. Outpatient care, in addition, because we need to move towards community services and support for families. So across the lifetime for a family with someone who's afflicted with autism, it's anywhere between $1.4 to $2.4 million across a lifetime for a family. And 1.4 is on the low estimate for individuals with autism who are classified as having an intellectual disability. Those with an intellectual disability, it's up towards $2.4 million a year for those families. So what do we know in terms of cost-benefit analyses? I can tell you that these numbers come from Harvard in the Center of Developing Child, and that the importance of early childhood learning, behavior, and health affect later development as well. So we know that 700 new neural connections are developed per second in the first few years of life. And these are critical for the form in terms of interactions between genes and their environment and their experiences and their interactions with adults and others in their environment. And researchers call this contingent reciprocity between genes and their environment. These connections build the foundation for later learning, behavior, and overall health. Again, at 18 months is the age in which the disparities of vocabulary begin to appear. So it's important that these early experiences and environments in which children develop in their early years have a lasting impact on their latest success in school and life. Some of the barriers that we know of these children's vocabulary first appear as young as 18 months, based on whether they were born into a family of high education or income or low education and income. By age 3, children with college-educated parents and primary caregivers had vocabularies 2 to 3 times larger than those parents who did not complete high school. And by the time these children even reach school, they're already behind their peers unless they're in a language-enriched environment. We know that 90 to 100%, there's a 90 to 100% chance of developmental delays when children experience 6 to 7 risk factors. And those risk factors include poverty, caregiver mental illness, child maltreatment, single parent, low maternal education. These all have a cumulative effect on whether or not a child has a chance of having a developmental delay. And these delays can be in one or more areas in terms of cognitive delays, language delays, or even emotional development. We also know that there's a 3 to 1 odds of adult heart disease from early childhood on if they have experienced 7 to 8 adverse childhood experiences. We also know that the cost-benefit analysis is that for $4 to $9 in returns for every dollar we invest in early childhood programs. So what we know is that getting this right the first time is easier and more effective than fixing it later in life. Early childhood matters because experience in early life have lasting impact on later learning, behavior, and health. There's highly specialized interventions as needed as early for these children in order to succeed and decrease stress and emotion, setting them up for success later in life. Early life experiences are the difference between children who experience participation in their community and society later in life than those children who don't. And basically, all societies would then benefit from early childhood programs. I was doing a doctor radio show the other day, and a parent called in, and her child was 3 years old and had recently received a diagnosis of autism. And this parent had guilt about the fact that although this child is 3 and relatively still young in early childhood, this parent carried guilt with her because she recognized the signs earlier. She knew something wasn't right. She couldn't quite put her finger on it in terms of what it was. She was a girl. Oh, well, autism is 4 times more prevalent in boys. The girl, she'll be a late talker. Her dad was a late talker. Again, so she's carrying around this guilt since the baby from 18 to 36 months, saying, I could have done something, I could have started earlier in early intervention, but I didn't. I was kind of wishing and waiting and hoping that she would catch up and this would go away. And there's nothing we can tell parents at that point in time when they're saying, I knew earlier on, but I didn't do anything about it. You have to say, but you can do something now. It's never too late to learn. You can get your child into intervention, and you have to focus on that. But imagine if she was screened in her 18-month well visit, and they flagged it, and she went on to have early intervention. You don't necessarily need a diagnosis to receive services. If she received early intervention prior to 36 months, what those differences were. So, I'm not a gambler. It's like sister, your mother, your spouse, your partner, and they feel a lump in their breast, and they know about that. And they say, oh, maybe it's related to menstruation, it'll go away, what have you. You would encourage her to go and get screened. You would encourage her to go to her doctor, because that is life-threatening. Autism isn't necessarily life